In many cases, pathologies associated with the osteomuscular system can be varied, and the therapy to cure such pathologies is few indeed. On the other hand, MLS therapy provides a fresh solution to these pathologies. This is accomplished thanks to a special control system, patented in Italy and pending in the United States of America, the multi-wave locked system. The results are evident. For the patient, this means immediate restoration of his or her own activities. On the other hand, MLS therapy allows doctors to provide an improved service to their patients, which truly hits the spot to the benefit of their profession. A doctor's success is truly important for the patient as well as for the doctor. And a contributing factor to success results from one's choice of medical equipment, which constitutes a determining factor to flourish professionally. ASA has dedicated to the doctors of today and those of tomorrow a family of 3 innovative devices for the application of MLS therapy. Behind every great product, there is always a great company. Behind MLS therapy, there is ASA. ASA. Our trademark devices can be found in many clinics and medical centers in over 50 countries around the world. Being a part of ASA means being a part of this world.
Any laser emissions can be linked to the sound emissions of a musical instrument. However, it's only the synchronized union of the 2 emissions, continuous and pulse, that create the harmonious effect. The harmonious effect of MLS therapy. In many cases, pathologies associated with the osteomuscular system can be varied, and the therapies to cure such pathologies are few indeed. In particular, the traditional laser systems can only provide partial treatment at best. In fact, they can either reduce inflammation of the affected area or reduce the pain, however, never both at the same time. On the other hand, MLS therapy provides a fresh solution to these pathologies. As a matter of fact, MLS therapy, with its dual action, kills the pain thanks to its pulsed laser emission and soothes inflammation and edemas due to its continuous laser emission. This is accomplished through a precise synchronization of the 2 emissions applied in a rhythmic manner, bringing each cell back to an optimal condition. Not simply a combination of emissions, but a strengthening of both therapeutic effects. This is accomplished thanks to a special control system patented in the United States and FDA approved, the multi-wave lock system. MLS therapy has proven itself to be an excellent solution for cases of tendinitis, epicondylitis, traumas, muscle strains, sprains and contusions, as well as lumbago, neck pain, backache, deep pathologies, bursitis, and periarthritis. The results are evident. These symptoms disappear. The metabolism of the tissue regains its proper balance, while at the same time the groundwork for a rapid recovery is built, indeed very rapidly. For the patient, this means immediate restoration of his or her own activities. On the other hand, MLS therapy allows doctors to provide improved service to their patients, which truly benefits their profession.
Pennsylvania physician Gene Santo has been trying to relieve pain for 20 years, using every medical tool available.
I use all kinds of injections, I use all kinds of medications, I refer out to multiple other specialists, and there always remained a number of patients that just weren't getting better.
Is that a problem too, as I move the hip around?
So I've always had my eye open for something that could treat those patients, and I think I found it.
What she found is the cutting-edge MLS laser, which uses light to alleviate pain.
What makes the cutting-edge laser unique is the multi-wave lock system. Basically, they've taken an 808 and 905 wavelengths and they've synchronized them. The tissue absorbs those wavelengths and that light triggers metabolic reactions in the cell that stimulate healing, that stimulate reduced inflammation, and stimulate pain reduction.
One of Dr. Santo's patients is Lisa Knott.
Hi, I'm here for my appointment today at 1 o'clock.
She has suffered from debilitating back and hip pain since high school.
The pain is absolutely immobilizing. I cannot, even at times, get out of bed.
After trying nearly everything else, Lisa recently began treatment with the MLS laser.
The same day that I have my treatment, I see significant results. My pain is definitely less, and I have more mobility.
It's been shown to reduce muscle pain, muscle fatigue, it improves wound healing, it reduces pain, and I think it will be standard in pain practices. Even regular primary care offices, I think it'll be standard.
Halfway across the country in Arizona, highly respected podiatrist Dr. Richard Jacoby has seen similar results.
It's a pretty amazing instrument. We call it the magic wand. A lot of patients come in who have had treatments for years and they have instant relief of pain.
I noticed the swelling went down right away and the pain was definitely less from one treatment. Now, I was amazed.
Those treatments offer not only medical benefits, but also financial ones. Dr. Santo expects her cutting-edge laser to pay for itself in less than a year.
I charge $60 for a treatment. Being paid in cash the day of treatment is a godsend. You know, I don't have to bill for this. I don't have to pay a billing company to collect it for me. I don't have to go after insurance companies or patients to, get paid past balances. I'm taking in a fair amount of money right now, and I haven't really even mentioned it to anybody outside of my current patients.
When you're talking about your quality of life, there is no amount of money that you can put a price tag on that. Your quality of life is important. And if you can't travel, if you can't work, if you can't go to the movies and sit for 2 hours, it's worth $60 an hour, for a treatment for me, any day of the week.
Money is really not a problem with this because patients are very, very willing to pay for this because it's something actually cheaper than their traditional treatments.
More and more doctors are using MLS laser therapy. They consider it an indispensable part of practicing medicine.
I see light as the medicine of the future, really. That light therapy will revolutionize the way we treat certain conditions. I think that cutting edge is wise to be in the forefront of that, and I think that pain doctors everywhere should be looking into this as a benefit to their practice, and particularly because it's the right thing to do for your patient.
This is probably the most transformative modality to come down the medical pathway in the last 50 years. It's that transformative.
What we're finding is 90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
So can you straighten it?
Yeah.
Okay.
Dr. Ronald Letterman is an orthopedic surgeon. He runs a busy practice in this medical building just north of Detroit. With a staff of 25, the Letterman Center uses all the standard tools for pain relief and healing. And it now offers something new, cutting-edge MLS laser therapy. Dr. Letterman used it first on his own mother, who was suffering from debilitating pain.
I was in San Diego at our annual academy meeting when she called me. She called to tell me she had 2 treatments so far, and she went from a 9 out of 10 pain to 1 out of 10 pain. She told me that almost all of her pain was gone. So I immediately called the office and I said, we're on.
The laser has been in constant use ever since, relieving pain and promoting healing.
This dual action, low energy light laser actually increases the mitochondrial activity of the cell. What that means is it creates a supercell which promotes healing. So now, not only are we offering this laser for patients to eliminate painful conditions, and some of these patients, by the way, have called us to cancel scheduled surgeries, but we're also offering it to patients who have had surgeries, and we're finding that they're healing faster. My best guesstimate is that we are seeing a 50% reduction in the healing time.
You start reading the science behind it and all the different outcome studies, and you say, gosh, this thing maybe works. And so we brought it into our clinic and we started seeing patient after patient responding with almost too good to be true. You see someone that has such debilitating pain and 1-2 treatments and they're 80-90% better. So it's been really miraculous.
One of those miracle patients is Tony Gamby, who endured severe ankle pain for 8 years.
After the first 7-minute treatment, I was completely without pain. I was smiling all day long because I hadn't walked without pain in a long time. And I can't wait to send other people in here to get the same benefits from it. I would spend the same amount or less on 6 treatments here than I would on a custom orthotic or any of the other devices that I've tried over the years to help me with the pain. And to be without pain like this, it's worth every penny.
These people are getting better. So in a sense, this has revolutionized my practice. Whereas I would have to say, throw up my hands and say, I'm sorry, there's nothing else I can offer you. We now have something to offer these patients. 90% of them are getting dramatically better.
MLS laser therapy is also improving this clinic's bottom line.
For the first time in 17 years, we are offering a treatment that is not covered by insurance. So you can imagine to offer a $500 or a $750 package of laser treatments to patients that's not covered by insurance really required a whole paradigm shift in this practice. And once we have realized the benefit of this cutting-edge laser technology, patients are now lining up for it. I don't know of any investment that pays for itself in a couple of months, but this looks to be one of them.
Price resistance has been almost non-existent. Another example is Penny Rao, who typically scored her foot pain at 9 out of 10 prior to MLS laser therapy.
Just being able to sleep, not having to take all the Motrin or a Vicodin or something to be able to sleep or just get through the day has really made a big difference. I think it's very reasonable for what it's done for me. The cost is like minimal.
If we can avoid a medication, have a laser treatment that's non-invasive, no side effects, very limited contraindications for patients that can't have the laser treatment, then why not try some? Why not try when the results that we've been getting are 90% plus?
Do you feel the difference?
Yes. That moves like...
Yeah. Every day I come to work, I feel like I have my ace in the hole. As we offer this to patients and as more and more patients sign up for it, we are getting more and more positive response from these patients, and it's changed the way we are practicing orthopedics.